Alright, so we have already talked about how CRRT works and the different types of CRRT modalities, CVVH versus CVVHD. And in a prior tutorial, we discussed real briefly how to calculate convective clearance. This time, we're going to talk about how to calculate diffusive clearance. And to do that, we're going to draw a little schematic of CVVHD. And let's label our flows first. So that's your blood flow. Okay, that should not be prime, so let's get rid of that. Now, instead of having convection, in other words, instead of having a replacement fluid here in the pre-filter position, we're doing CVVHD, we're doing clearance via diffusion. And so we're going to have dialysate fluid running in the opposite direction. Now I'm going to shade this a little yellow, and I'll explain why this is part green, part yellow in a moment. So this is your basic, very simple setup for CVVHD. There's no convection occurring here, or very minimal convection, because most of the clearance is occurring through diffusion. And so we want to calculate diffusive clearance. Now we're going to use the same principles as before, which is that number one, the ratio of the solute in the dialysate will equal what's in the blood over time, and number two, if you calculate your clearance over time, those two parameters will cancel each other out. So let's just say the concentration of a solute in the dialysate, in this case we'll say D, over the concentration in the plasma or the blood. And of course, plasma concentration is not exactly the same as blood concentration, but for the purposes of calculating a clearance relatively quickly and on the floor when you're dealing with patients, you can equate plasma concentration and blood concentration to each other. So you've got the ratio of the concentrations, and then you have to have the fluid that's removed, the quote-unquote urine that's produced by the CVVHD machine. And in this case, it's this. This is your basic structure of a diffusive clearance equation for CVVHD. Now let's clean this up a little bit and add a few more parameters to get an answer that's a little bit more accurate. So we'll draw our CVVHD machine again. This is your filter, well, what I'm drawing here right now. Here's your blood flow that's coming in and going out. So nothing different here between CVVH and CVVHD. And now we've got to add in our dialysate fluid, which we say goes in here, comes out here. A few more, or one more actually, parameter that we have to add in, and that's this. And we're going to call that. Alright, so we have dialysate fluid that's coming in and going out, and that's the quote-unquote urine that's being produced by the CVVHD machine. But we also have this new parameter, and I'm going to change the color because I don't want to get you confused with the prior tutorial. We've got this new parameter called ultrafiltration rate, and it's really not that new, but it's the fluid that we're removing from the patient. There we go, that's a better color. And sometimes this is set at 0, but sometimes it isn't. So this is also, quote, part of the urine that's being made by the CVVHD machine. So let's go back to our equation and see if we can clean it up a little bit. Diffusive clearance is going to equal the concentration of the solute in the dialysate divided by that concentration in the plasma. And we're going to multiply it by the quote urine of the CVVHD machine. Now the urine of the CVVHD machine is actually that dialysate fluid rate plus the ultrafiltration rate. And normally this is set at 0 because the patient is critically ill and most likely hypotensive. But if you do have that set at something other than 0, you just add that to the dialysate fluid rate. Now we had an assumption that the concentrations in both compartments, the dialysate and the plasma, would be 1. So this cancels out. So you end up with diffusive clearance equals your dialysate flow rate plus your ultrafiltration rate. And there you have it. That is a very simple way of calculating diffusive clearance for a patient who's receiving CVVHD.